We're still waiting for a few folks to trickle in. So if you can hang tight for a moment. While we're waiting, if you want to check out some of the features, especially if you're new or newer to using WebEx, if you want, there's a chat bar that you can access by hovering your mouse and clicking on the speech bubble. And to test it out, maybe you could enter where you are viewing from tonight. And we'll get started in just a moment. Okay, we've got some local folks. A lot of Virginia and Maryland, but I did see a Florida and Boston. Wonderful. So I know some folks will be joining us, but just to honor everyone's time, we're going to go ahead and get started. We have an amazing program for you all, a lot of wonderful folks here today. And I just want to start by saying thank you for joining us. My name is Kylie Stamm, and I serve as the Elliott School of International Affairs Diversity Program Manager. And tonight's event is called the Town Hall on Anti-Racism and Strategies for Inclusion in the Wake of COVID-19. So I'll be the moderator for the webinar, and I'm really excited to have you all here. I want to give a really big shout out to the Elliott School and also our collaborators in the School of Medicine and Health Sciences, each of our incredible panelists who you'll have the opportunity to see, and our fantastic behind the scenes staff for making this event happen. A lot of people brought it together, and I'm just really excited. I'm also newer to webinars, so I'm really grateful for everyone's patience and support. It's been interesting going virtual. I know that everyone's sort of figuring that out. Yeah, thanks for joining us in this way. It's a really important topic. So before we get started formally, we also wanted to say there's a couple of key guests that we wanted to take a moment to appreciate. You'll see Bob is one of our American Sign Language interpreters, and we will also have Lucy. They'll be alternating between the two. There is a feature if you want to hover over their icon, you can actually use a push pin to hold them in place so that as other speakers come through on the screen, you're able to keep them in your line of sight. We also have captioning services provided by Darren, who's doing that live. So that should also be appearing on your screen under the chat. Thank you to all of you for helping with those services. And then for your personal view, you can hover over your own screen in the top right corner and you can change your view of the different panelists, so you can play around with that. Just so you know, during the webinar, all of the attendees are in listen-only mode, so you can use the chat, but if you have questions, we actually request that you submit those through the Q&A feature specifically. And if you can't see that, you should be able to hover over your screen, and there's 3 dots at the bottom to give you more options, and you can select Q&A. I'll be monitoring the questions, and we'll save them all for the end, just because we have a lot of incredible content to get through, and we want to make sure that we can do that. So I think those are all of the logistics. Everything else is going to be incredibly exciting. So without further ado, I think we're going to go ahead and get started. So we're going to jump in and turn it over to our panelists. We're joined by 6 of our community members from our respective areas. Let me show you them on the screen. Oops, that's our dean. So these are the 6 folks that we'll be hearing from tonight from Elliott and from the GW School of Medicine and Health Sciences. They're all wonderful folks. And so we're going to start tonight with Dean Brady. I can't tell you how grateful I am to have him here for such an important topic. So I'm going to tell you a little bit about him, and then I'll turn it over to him. Ambassador Reuben E. Brigady II, most recently served as the appointed representative of the United States of America to the African Union and permanent representative of the United States to the UN Economic Commission for Africa on September 3rd, 2013. Prior to this appointment, Ambassador Brigidi served as Deputy Assistant Secretary of State in the Bureau of African Affairs from November 2011 until September 2013, with responsibility for Southern African and regional security affairs. Ambassador Brigidi is a 1995 Distinguished Midshipman graduate of the U.S. Naval Academy, where he earned a BS in Political Science with merit, served as a brigade commander, and received the Thomas G. Pownall Scholarship. He holds an MPhil and a PhD in International Relations from the University of Cambridge, England. And Ambassador Brigidi is a member of the International Institute for Strategic Studies, a life member of the Council on Foreign Relations, and a recipient of the Council's International Affairs Fellowship. So without further ado, I'm excited to turn it over to Dean Brigidi. Thank you so much.
Hi, Kylie, and good afternoon, everybody. And huge thanks to Kylie for organizing this very important panel. As you can see, I'm wearing a coronavirus casual today, as we all adapt to this new reality of the novel coronavirus pandemic. First of all, let me also say Happy Asian Pacific Islander Month to everyone. And it is both a time to celebrate the contributions of Asian Americans and Pacific Islanders to our great country, but also, quite frankly, in the context of the current environment, to reflect upon the particular challenges that our brothers and sisters of Asian descent are facing in this environment. It is almost regrettably a universal truth that fear can often bring the worst out in many people. And I think that in the context of this horrible pandemic that is touching the entire world, we clearly recognize that many of our Asian members of our community are being subject to amongst the most vile and dangerous expressions of xenophobia and racism, which is completely unacceptable. And let me say unequivocally that I personally stand shoulder to shoulder with all of our brothers and sisters of Asian descent, and that further, that our commitment to diversity and inclusion at the Elliott School is ironclad, and is so in the best of times, and even more so when particular members of our community are exposed to being particularly vulnerable to the times. These circumstances in which we find ourselves now will require all of us to demonstrate a level of resilience and compassion and creativity and determination that collectively we may not even know that we had. But just as difficult times can bring out the worst in people, they can also bring out the best. And we are committed to demonstrating the cohesiveness of our community, the strength of our compassion, and our commitment to inclusion and diversity amongst everybody. So, as we have our conversation today, and as we hear about the experiences, the concerns, the triumphs, and the sorrows of all of us in this extraordinary time, please know that I, as your dean, and also as representative of our leadership, stand very closely with you, and we look forward to hearing what's on your heart. Thank you very much.
Thank you very much, Dean Brigidi. We really appreciate your comments, and in your presence really does mean a lot. So thank you. And I want to echo Happy Asian Pacific American Heritage Month. A lot of colleges are recognizing it this month, with nationally in May, but just to give us a full month to celebrate. So thank you for that as well. So to examine some of the historical context around the topics we'll discuss, our next panelist is Dr. Alexa Alice Jobin. And Alexa is Professor of English, International Affairs, Women's Studies, and East Asian Languages and Cultures, as well as co-director of the Digital Humanities Institute at GW. Her latest book, titled Race, which was published as part of the Routledge's new Critical Idiom series, is part of what she'll be talking about today. So I'm going to turn it over now to Dr. Jobin.
Hi, thank you, Kylie, for organizing this. A big thank you to your team as well. COVID-19 does not discriminate, but racial discrimination adds undue stress to the society as a whole. The global public health emergency threatens our ability to concentrate on our cognitive resources for important information. I want to echo Dean Brigity's point about fear. And I have a pragmatic proposal to combat anti-Asian racism. We can increase our cognitive bandwidth by learning more about history. In contemporary American culture, race often brings to mind people who are not white, while whiteness remains unmarked and serves as a benchmark category as if white was not a race. Kylie, can I have the next slides, please? Kylie? Kylie, can I have the next slide, please?
Yes. Is it changing for you?
Yes. So in other words, I find that there's a feature in contemporary American racial discourse that tends to focus on Blackness and whiteness for very good reasons, but that does obscure other groups in the US, such as Asian Americans, Hispanics, Latinos, Chicanos, and Native Americans. One thing we notice in our current climate is the language of disease is intimately connected to racism, and this is not a new phenomenon. If we look at this astonishing advertisement for a magical washer, it's a soap, with the caption, "The Chinese must go," we can have a peek of the kind of history we're looking at. Kylie, can we have the next slide, please? So you're going to have a closer look at this. The cartoon shows Uncle Sam with a proclamation in hand and a can of magic washer saying the Chinese must go. This is from 1886. In fact, in 1895, we're going to move on to the next slide. In 1895, after China's defeat in the First Sino-Japanese War, both Kaiser Wilhelm II of Germany and the Chinese scholar Yan Fu himself, both of them used the phrase yellow peril and a metaphor of a sick man to describe the Chinese people. In 1898, the concept became the title of British novelist N.P. Shiv's short story, Yellow Danger. So with advertisement, when with this kind of mini history, you understand that the anti-Asian sentiment runs quite deep in the West for quite some time now. It just emerges at different times, articulated differently. Coming on the disease of the same name, David Henry Hwang uses yellow fever in his play M. Butterfly in 1988 to describe white men with a sexual fetish for East Asian women who are imagined to be subservient, dainty, and more feminine. Perceptions of Asian identities reflect the legacies of colonialism that seek to govern exotic bodies. And I brought in gender because race can never be separated from gender. You can see how the two play out. The idea of yellow peril intersects with gender stereotypes, and specifically the stereotype known as yellow fever. The racialized myth about Asian women provides a partial explanation of the baffling phenomenon of white supremacists in the US, exclusively dating Asian women. The exceptionalism that white nationalists have granted to Asian Americans fall neatly along a gendered fault line. While Asian Americans are often seen as the hardworking model minority who assimilate well into North American society, it is specifically and only Asian women who the white nationalists embrace. As it turns out, there is a long legal and institutional history behind the phenomenon of yellow fever and the idea of yellow peril. It goes back to the era of Chinese Exclusion Act, which was in force from 1882 to 1943, the time when whiteness became the dominant racial norm in the United States. The legalization of discrimination effectively marked Chinese workers free and feminized laborers who undermine white working men's ownership of their, quote, free labor. Chinese immigrants were both a desirable other in service of the United States and a codified threat. Female Chinese immigrants were assumed to be sex workers unless proven otherwise under the Page Act of 1875, which was erected under the guise of anti-trafficking laws. Similar restrictions were imposed on Indian women in British colonial Caribbean. At work here are both a yellow peril discourse and an imperial civilizing rescue mission. Before 1922, if a female US citizen married a foreign man, she would assume the citizenship of her husband and lose her US citizenship. The Cable Act of 1922 partially amended the situation by allowing married women to retain their US citizenship if their husbands were aliens eligible for naturalization. Asians, obviously, were not eligible for US citizenship, and American women who married Asian men at that time would not be protected by the Cable Act. As we have seen, race is profoundly constituted by language. It is all about the words we choose to use. Next slide, please. And this reminds us of W.E. Du Bois' formulation of double consciousness back in 1897. For minorities living through the strange time right now, they probably feel a peculiar sensation, to use Du Bois' words, of always looking at their self through the eyes of others, of measuring your existence, your worth, by the tape of a world that looks on in amused contempt and perhaps pity. Next slide, please. So in conclusion, we need cognitive ability to survive the global pandemic. But racism depletes our bandwidth for cognition. So my plea is a selfish one. It's not a moral one. It's not about whether racism is right or wrong. At the very basic level of survival, racism is there as a virus to deplete your bandwidth for cognition and to kill you, just like the virus can. In a high stress situation, people rely on their intuition, and this has been proven by psychological research. However, when you abandon analytical thinking, when you rely on intuition that is influenced by implicit biases that hinder deep thinking about issues, that is truly the beginning of our demise. So I think collectively, we need to fight racism, not just because I imagine I'm preaching to the choir here. So I'm kind of taking a slightly different approach to speak to the part of society that wouldn't think about combating racism because they think it is good for themselves. And my message here is that racism kills you, kills your community, because you are giving up analytical thinking, analytical reasoning. That's the foremost things that we need in any crisis situation. Thank you.
Thank you, Dr. Jobin. That was a lot of information to take in at once, a lot of important information. And I know as someone who has tried to study Asian and Asian American history, it is really complex. And so I really value your voice and input, at least to give folks some things to think about. Next up, we're joined by an alumna Anna Raphael. And Emma is here to address perspectives surrounding U.S.-China relations. Emma is a senior manager of policy specializing in China and Greater Asia with the Information Technology Industry Council. In her role, she specializes in U.S.-China relations, international standardization, and policies in East and Southeast Asia relating to digital trade, cybersecurity, privacy, and emerging technologies. Prior to this position, Emma supported the policy team as a China graduate fellow while pursuing her Master of Arts in Asian Studies at the GW School of Elliott School of International Affairs. Before joining ITI, Emma interned at the U.S. Trade Representative's Office of China Affairs, focusing on technology policy and intellectual property issues in the U.S.-China bilateral relationship. Emma, thank you so much for being here. I'm going to go ahead and turn it over to you.
Yeah, thank you, Kylie. And thank you to Dr. Jobin as well. I think that all of that information was really good historical background into what we're looking at today in terms of US-China relations. And I think ultimately a similar message that I would have both looking ahead to when we will hopefully recover from this virus, both in terms of our view on race in the United States, and also as we seek to build alliances and recover the economy. I think one really important thing to realize out of all this is that global coordination and cooperation is extremely necessary as we're looking at a variety of different failures of our economic system, as well as all of our healthcare systems being very strained. The US and China, being the two largest economies, really have a unique opportunity to work together in resolving this crisis. But unfortunately, they are both quite preoccupied with placing blame on each other for the spread of the virus and their respective responses to the virus in each country. Some of these disagreements have been extremely public, either in press conferences, as well as public assemblies at the UN. And this lack of coordination between the two countries really precludes a lot of additional coordination between some of the other leading economies in the globe. We've all seen the news about the WHO today or yesterday. And it also continues to worsen an already fraught bilateral relationship between the US and China. There is a lot to also unpack between both countries, the kind of blame that they're attributing to each other, both with regard to China's transparency on the origin of the virus, and also to the US on a variety of different statements that they've made about responsibility. I'm not going to dive into any of those, and I'm not going to make value judgments on them, but I would like to say that it's clear none of this fighting is helpful for the purpose of trade facilitation, boosting supply chains, or sharing valuable medical information and research data. These are all three really important things as we're looking at trying to support businesses and individuals going through this crisis at the moment to get personal protective equipment to the right places and other really vital materials and equipment to essential workers. I think we're at least seeing a cooling in those public attacks. Presidents Trump and Xi have been able to talk over the phone, and President Trump has slowly decreased his use of the term Chinese virus. But for victims of racial bias in the US, this obviously appears to be too little, too late. One thing about this increasingly unfortunate bilateral relationship, before even COVID-19 was on the scene at the beginning of this year and late last year, foreign relations were already in a pretty precarious place. We are currently engrossed in a trade war between those two largest economies, and the anti-China sentiment that dominates American politics has really fostered a ripe environment for racially targeted actions among the general public, but also has fostered an environment for policymakers to make very decisive but occasionally unproductive decisions. While not all the measures that target China or Chinese policies are racially biased, I think the coronavirus has really elevated the level of misinformation and xenophobia that influences policy. Some specific examples are attempts to carve China out of the medical supply chain. This was happening in February and late January. Now we see, obviously, that China is going to be very essential to helping supply equipment around the world as China recovers and the rest of the world continues to deal with the crisis. There have also been a lot of thinly veiled accusations from a variety of public figures that China intentionally brought the virus to the US, and that has continued to inspire other conspiracy theories about hoarding of protective equipment and a huge variety of fun conspiracy theories that I won't get into. I think this is all important as we talk about the historical dynamic and where we're seeing both the interaction of government policies and its effect on individuals. There's often very little line between what we call China and the Chinese, which becomes quickly quite problematic, as we saw with usage of the term Chinese virus or Wuhan virus. And it's having lots of other spillover effects into the way that we continue to use China as a political tool in our own domestic elections. And again, abandoning, as Dr. Jobin said, a lot of clear analytical thinking. One thing that I just wanted to highlight for this audience is the travel and visa restrictions that create particular challenges for international students going between both countries. A lot of study abroad students are now left in limbo trying to plan ahead, and they don't know what will be coming in the future. But there have also been a number of different travel restrictions either into China and visa restrictions for the United States that have been implemented. And given the US stance on immigration with this current administration, there are some really valid worries that those restrictions will be much harder to lift in our recovery time than they have been to implement in this time of crisis. So in conclusion, I would just like to say that efforts to separate notions of governments from people and those edge cases where there are threats that happen to present themselves under a Chinese national or Chinese Communist Party flag have to continue in order to let each country allow or realize the benefits of educational exchange. Even though we may associate individuals with the country of origin, there's a great amount of diversity that we have to take into account about their goals and aims and where they're coming from. And none of the current policy moves that we are making are necessarily constructive to actually saving lives. Thanks.
Thank you, Emma. As I'm listening to everyone, I just realized that each person could probably have their own hour-long webinar and a lot of important discussions to follow. So I hope as folks are talking, if you can submit them and we could hopefully circle back. We're transition to Dr. Adrienne Poon. And I'm going to read her introduction first, just to let you know a little bit more about her, particularly as we think about COVID-19 and the strategies for inclusion that we've Adrienne, I'm actually going to have you mute while I'm talking for feedback. So Dr. Adrienne Poon is an assistant professor of medicine in the Division of Hospital Medicine within the Department of Medicine. She holds a Master of Public Health from Drexel University with a concentration in health management and policy focused on systemic racial and ethnic health disparities and Asian American health, and previously worked to support the global HIV/AIDS response in Beijing, China. She's an honorary research fellow with the University of Edinburgh as a part of an academic health research collaboration with Peking University to study China's health transitions, disparities, system, and reform. She's an active community member and serves as the VP of Public Affairs for the DC chapter of OCA, Asian Pacific American Advocates. Dr. Poon, thank you for joining us. And we actually generated a few questions to ask you specifically. So I'll read the first one. First, can you describe some of the major misinformation about COVID-19 that you recognize, and what would you like folks to know as we continue navigating the pandemic? And then, what is the significance of using accurate terminology when referring to COVID-19? I know Emma made reference, what are the implications of using terms as the Chinese virus or Kung flu? So if you could talk to us about some of that, that would be wonderful. Thank you.
Major racialized misconception is that people of Asian descent, such as Chinese Americans, were more likely to get and spread COVID-19 than other Americans. This is simply not true. COVID-19 is a highly infectious disease, and it's transmissible by droplets and contact between any human being. The World Health Organization created the name COVID-19 specifically to avoid reference to any particular region or its people, given concerns of stigma. Misperceptions such as the terminology, including using Chinese or Wuhan virus and Kung flu, unfortunately, has led to an alarming rise in racially motivated attacks on Asian Americans and a climate where many community members are living in fear of being attacked. An example of one of these hate crimes included the racially motivated stabbing of a Burmese American man and his 2 children, ages 2 and 6, because the attacker thought they were Chinese and infecting people with coronavirus. There's been other reports of Asian Americans being verbally assaulted, spit on, even sprayed with Febreze. Some Asian Americans who've been following the news in Asia remember living through the first SARS epidemic, and the stigma had adopted the preventative measure of wearing masks early on the COVID epidemic in the US. Although this measure may have prevented infections from spreading in the community, people wearing masks were also reported being attacked or alienated, which raised fear around adopting this preventive practice. And this also unfortunately happened with many of, especially international students across campuses in the US. Sadly, these hate crimes are occurring in setting of historical context that include some of the discriminatory laws and policies that we heard about earlier in this panel, and stereotypes that Chinese are more likely to be diseased. During the 1900 bubonic plague, for example, the San Francisco Department of Health overnight quarantined about 30,000 Chinese Americans in Chinatown using barbed wire and ropes, but allowed free travel for white citizens under a stereotyped and inaccurate assumption. In the recent climate of fear around the current epidemic, several organizations have created reporting systems, and one reported over 1,000 race-related incidents since putting up the system. In response, recently, Congresswoman Grace Meng introduced a resolution to both document and investigate hate crimes, incidents, and threats towards Asian Americans, and to see if we can hold perpetrators accountable for these crimes. Yeah, I would say, despite all this fear, this hysteria, members of the Asian community have been rallying together to try to make donations of medical supplies to hospitals to protect healthcare workers, including in the local DMV area. And I think this really sends a strong message that we in the Asian American community are part of the fabric of America and are making these contributions to support this country's response to the epidemic. So, I think, next, maybe, I wanted to talk about some of the strategies that we could think about to support disproportionately targeted and vulnerable groups during this pandemic. I mean, I wanted to point out that, any human is susceptible to the virus causing COVID-19. Alarming trends have been suggesting that various communities of color, particularly the Black community, have been disproportionately affected. And also, there's been reports of the COVID-19 epidemic spreading in Native American reservations, Latino communities. In the DC area, about 45% of cases and 76% of deaths were in Black patients. This is really alarming and likely due to historical institutional discrimination that has perpetuated disadvantage and widened the existing health disparities that we already see and know about. And these factors include where people live, especially if it's in disadvantaged neighborhoods with higher levels of traffic and pollution that can worsen lung disease, or what people have access to in terms of.
She's without controlling her time.
Oh, sorry. Hello, can everyone still hear me?
Yep.
I can hear you.
Okay. But yeah, also, I guess the other concern is what disparities are perpetuated by what food people have access to in the neighborhoods. Because fresh food deserts and lots of fast food can worsen hypertension, diabetes, and heart disease, and that makes for poor outcomes in people likely in people with COVID-19. And to support these disproportionately targeted and vulnerable groups, we really need to apply public health strategies that have been shown to be effective, including building trust in communities by working with community leaders, sharing information, understandable to a broad range of health literacy and language abilities, and also collecting and reporting demographic data by race, ethnicity, and primary language. And we need to be proactive about this so we can better identify where the disparities are and work with disproportionately affected communities, develop community-based strategies to reduce the impact of those who are already historically disadvantaged. And, I think I'll just leave you all with, just reminding everyone that to follow health guidelines, to respect social distancing, wear cloth masks, and, wash your hands often with soap and water. But, I think it's really part of the response is really from the community level.
So, sorry to interrupt. This is Anthony with Public Affairs. I'm just backup event support. It looks like Kylie has actually been booted out of this event. And Alexa, it looks like you might be the host.
Somehow I'm the host, but it's fine. I'm not too uncomfortable with this. So our next speaker is Adrienne Poon, who's an undergraduate at GW and political science. I'm going to try to share my screen and have this one up. Are you there?
Yeah, I'm right here.
Great. Okay. Get started.
I'll go ahead. So, hi everyone. Thanks for coming out. So, if you haven't seen my campus running around, my name is Gabriel Young. I am in the Columbian College of Sciences and in the LA School of International Affairs. I serve now as the Columbian College of Arts and Sciences Student Association Senator on the SA, and I also serve on the Diversity and Inclusion Assembly, as well as working with the Elliott School's Diversity and Inclusion Program. So I'm pretty sure all of us have our own perspectives of what's going on, but to communicate to the adults who are here with us today and faculty, how students really feel and the perspectives that students hold. So students are really stressed. They're from the class of 2023. They are missing the unique opportunity to enjoy their first freshman year of college, whereas the class of 2020 are missing the opportunity to have their graduation on National Mall and have a celebration that celebrates the entire 4 years of work that they have put into GW. Along with that, organizations are canceling events, leading to people feeling unhappy. Students also had to hastily move out of dorms, and are now having movers actually move their items out of their dorms for them while FaceTiming them at the same time. And some movers are even telling students what they found in other students' rooms, leading to an invasion of privacy and student activism causing and writing more petitions. Along with that, this leads to student unhappiness. There's a lot of misinformation and a little too late information that's being sent out. Students were very unhappy that their spring break, they were encouraged to stay home, only to receive the news later on that classes will be canceled for the entire semester, leading to some students' spring breaks being ruined and being unhappy that they couldn't even pack up the rooms themselves. In fact, today CNN has just released an article that says that universities across the entire nation are considering to not have in-person classes in the fall, leading to even more student unhappiness and stress as students are contemplating how they can actually focus in their online classes and survive in their own household in a place where they may not have the resources that their school actually has. Personally, one of my classes has even released a survey asking us for our own opinion on online classes. Other students who actually were on study abroad programs, although they already paid for the full price of the program, had to pay even further to find a way home after their program has been canceled, with no or little to no reimbursement supporting them. Along with that, there's been a lot of anxiety that have been raised among students, such as reading articles and not knowing where to direct our feelings towards. Because as online classes are hard enough, as some professors adjusted really roughly, and students aren't able to learn the same way nor make the meaningful relationships, students have began lashing out at others and expressing their own disappointment and targeting their frustrations towards other people's, whether it be pointing fingers at university administration, their own friends, or even making it political. And eventually this leads to them taking their opinions harshly out online and developing uninformed stances. Sadly, one population that isn't talked about a lot is our international student population. Some classes are still forcing to have synchronous classes, and people maybe so, and especially some of my friends who live um, across the world, some who went back home to Taiwan, Shanghai, Singapore, Japan, still have to take these classes despite it being a 12-hour time difference, meaning that the usual 3 p.m. class here at GW would be 3 a.m. for them. Along with that, students are forced to go home into worse areas. An example is, although I am from San Jose, California, and Santa Clara County, I'm currently residing with a family that live elsewhere due to Santa Clara County having 1,666 cases as of April 13, while the entire state of Virginia, not a county, only has 1,207. So this leads to students feeling frustrated and wondering how they can get involved and how to break this typical stereotype of the broke college student since students can't donate. So, and there are options that I've been doing and my friends have discussed as well. One is researching and trying to find out and search for ourselves how we can get involved. And we can do this through visiting and searching new websites and organizations that can help out, especially within the Filipino American community. One important alliance, the Kabataan Alliance, is uniting Filipino youth across the entire nation in order to develop a united stance against Asian American racism. Another thing we can do is read credible news sources and stay informed. A lot of the resources that are being offered out on WeChat or Facebook could be misleading sometimes or even unreputable. And this, even having our own parents believe them, is harming our own ability to be civilly engaged and finding the truth out for ourselves. Another way we can do this is discussing with our own professors and to join webinars just like this one. And this can even lead to reading books such as a book that I have here, The How to Be Anti-Racist by Ibram X. Kendi, and which details plans and theories into how racism is a socially created construct and how we can change the entire social constructs that have been placed within our past. Other things such as outreaching from home and accumulating your own resources. Us students are huge on social media platforms, Instagram, Facebook, Twitter, TikTok, and whatever. It is so easy to be apathetic and mindlessly scroll. However, we have the ability to be creators ourselves and actually deliver a message out to our own community. And it is this overcoming of fear and reaching out which can help our community continue. And once quarantine stops, will even allow us to have a developed stance that we can debate and litigate with people who may feel differently with us. Now, for some Asian American initiatives, as stated, April is Asian Pacific Heritage Month, and a lot of GW orgs and college orgs in general had to cancel their own events and are bummed about it. This sort of analogy I like to use as if you worked on a project for a class only to not have credit given to where credit should be given to. And so for all students and my fellow peers, it's important to reach out to fellow e-board members and friends who actually created these events because they don't have the ability nor energy to conduct these events virtually due to time zone differences. And so it's important to be in solidarity and support our fellow friends who are unhappy and are affected by COVID-19. Along with that, it's also reaching out to the Asian American community in general. One very good reputable news source, NextShark, focuses its entire news on Asian American news, and this can help those who aren't very familiar in the Asian American community gain perspective and solidarity with them. It's also very important, as everyone is speaking, not taking hate and discrimination out on other people, as playing fire with fire doesn't help as it creates the fire even bigger. Currently, there's a lot of tension going on with the African American and Asian American community, as in Guangzhou, China, a McDonald's was reported to kick out African customers due to them trying to direct COVID-19's origination towards African customers. And although this McDonald's has issued an apology, this has already created social media tension where people are still throwing blame against each other. Although we do want to stand up for ourselves, Asian Americans must also remember, and students, that it is not better to play fire with fire, but instead be patient and let the fire die down. And so once we get out of quarantine, we can actually have a developed stance to make a dent in the world. Thanks, everyone.
Thanks, Gabriel, and hi, everyone. I was kicked off for a moment, but I'm back and happy to be with you all. I know, Gabriel, I appreciate you being here. I saw in the RSVP, you know, we've got over 100 folks attending and at least half are students. So I appreciate your voice, and we hope to create more spaces for students too, though this is a very complex time and process. So definitely keep sending your questions our way, and we'll try to address as much as possible. We're going to transition to our last speaker, Dr. Grace Henry, who is the director of GW School of Medicine and Health Sciences, Office of Diversity and Inclusion, and she's also an adjunct assistant professor of medicine. Dr. Henry is responsible for the development and assessment of strategies and programs designed to increase and enhance diversity, which fosters a school-wide culture of inclusive excellence. So Grace is here today speaking with us about centering diversity, equity, and inclusion during a global health pandemic and ways for us to think deeply about inclusion at this time. So Grace, I'm excited to turn it over to you. Thanks for being here.
Awesome. Thank you, Kylie. Thank you, everyone who's spoken before. You know, the disadvantage of speaking last is listening to everyone make the points you intended on making. I think this is such an awesome opportunity to have a discussion that I think we're sort of overdue in having. I think it's important for us to center, particularly this conversation, on Asian and Asian American individuals and the racism that we are seeing in that space. I think in addition, one of the points I want to leave with you is that we have to remember that ultimately this is racism. So we're talking about a specific group today. Unfortunately, we'll probably be talking about another group on tomorrow, but despite who the target group is, the issue that we are all fighting against is racism. Racism is the offspring of white supremacy. It is that belief system that any other identity, as Dr. Jobin touched on when she gave us all that background in terms of the Chinese Exclusion Act and other policies, legal policies that excluded Asian and Asian American individuals, that, you know, white supremacy believes that every other race, every other ethnicity is simply not as important. It does not matter as much. And even as Gabriel talked about Dr. Kendi's book, How to Be an Anti-Racist, he says it's not enough to simply be not racist. You can't just say, I'm not racist. You actually have to be anti-racist. You actually have to initiate policies, conduct yourself in a way that says, not only am I not for racism, but this is what I'm going to do to actively and intentionally eradicate racism. Dr. Bernice King, she's the daughter of Dr. Martin Luther King. She tweeted this week, she said, racism is not a difference of opinion. I love that. That caught my attention when I saw it. And that so many times we like to be a little bit delicate when it comes to race, a little bit delicate when it comes to racism, but I think we really have to be bold in this time as we're talking about what's going on. And so being allies, when we see someone make a joke about Asians or Asian Americans, really speaking up in that moment. We saw, unfortunately, what happened to that family, really intervening in ways that we can to really get rid of what is a problem in America. I like to say race is a four-letter word in America. We never like to talk about it, but it's ever present. So we have to remember that ultimately, whether it's anti-Asian racism, the core issue that we need to deal with is racism. The next point I want to make is as we create policies, as we come out of the quarantine, we're going to have to figure out how to uncover our blind spots. And now it's referred to as a blind spot because it's a spot you cannot see. And so it's not only important for us to have different faces around the room, but we're making sure that we also hear the voices. So we're hearing different voices in addition to the different faces. We have to remember that for some of our students, their lived realities at school will be completely different than their lived realities at home. You know, I was thinking about, had this happened when I was in college, although that was a long time ago, you know, just everything holding steady. For me, it would have been a really difficult situation for me had I been at an institution that closed down or prevented me from coming back. I was born and raised in the Virgin Islands. I came to DC for college, and during breaks, I couldn't afford to go back home, so I typically would catch a bus up to New York to stay with my aunt. So I've been really thinking, if I couldn't have gone home to the Virgin Islands, if I could not have gone to New York, where would I have been? Spring breaks for me were opportunities for me to work more so I can get more money. And so if I couldn't work, if I couldn't go home, how would the institution have been able to support me? And I think we have to remember that for a lot of our students, their college experience looks nothing like their lived experiences. And so when we're thinking about policies, we have to uncover the blind spots, the areas that we do not see. Yes, we're making sure that students are moving off campus, but where are they moving off campus to? And so we're gonna have to think a little bit differently in terms of how we support our students. I would even suggest that if we are at points where we feel like we've exhausted what we are willing or able to do institutionally, we should ask the community, ask our staff, our faculty, really to help support our student needs at this time, because we basically are all in it together. We keep saying that. And that leads me to my last point, that we have to know the stories. So what does that mean? I think to identify appropriate strategies, and as we come back to life as normal, as we keep talking about, I think we have to remember that it won't be normal for a lot of people. We will be working around staff and faculty and students and other stakeholders who've lost parents, who've lost spouses, they've lost loved ones. But do we know that story? And so Iyanla Vanzant, she talks a lot about being each other's keeper. And I would suggest that as we continue to think about what are the strategies we'll need to be in place, I would offer that we need to know each other's stories. Is my colleague a little different today because he lost his wife to COVID? I think these are going to be things that we need to know. I was raised in a more collectivistic environment, and so we always knew each other's stories. We knew each other's lives. And I think that as we think about this new decade that we also celebrated 4 months ago, that in this new decade that we adapt new things, we adapt new ways of knowing. And I think as we think about how do we support our communities, including our students, our staff, our faculty, our physicians, our community partners, I think we're going to have to think on these three things. That one, it is racism. We have to be anti-racist. We have to be actively demolishing and bringing down structures of power. We have to uncover our blind spots. What is it that we don't see? How do we engage the voices and the realities that typically aren't the ones that we think about? And then lastly, we have to know the stories. We have to know who we're working with, who we are working for. And I think once we really center these three areas, we can come up with strategies that will help to create inclusive, prosperous, and successful communities. Thank you.
Thank you, Grace. No one better to close us out. I feel inspired and activated, especially in such a difficult time. I want to thank everybody for their comments and feedback and perspectives tonight. I think, like I said at the beginning, we could all have many of these portions of these conversations for significantly longer periods of time. Unfortunately, we're at time. And so if anyone wanted to submit a question, we might be able to. Yeah, sorry, I was just reading the questions. We got a lot of gratitude, so thank you. I might be able to ask one. Let's see. Oh, well, some folks have asked if they'd be able to share the webinar. And so the plan is yes, and it is recording. I did personally disappear for about 5 or 6 minutes, so I'm not sure how that'll impact the recording, but I'll do my best to send out what we have. If anything, I know we have someone who is actually producing a transcript of the discussion. So at the very least, we'll be able to share that. So I'll send a follow-up email to everyone with that information. If any of the panelists want to come back to the screen, if you are comfortable. Everyone's saying thank you. Okay, so here's a question. And if you want to answer, let me know. How do you feel that issues of racism in the classroom during this period can be addressed by universities in a time of digital learning?
Perhaps I can answer that, Kylie.
Thank you.
And the short answer is you answered and you addressed it in the same way that you would if we were in an in-person classroom, is that you make sure that you utilize in the context of GW the reporting mechanisms that we have set up centrally for reporting race-based incidents, which we had set up and addressed long before the COVID-19 pandemic. And failing that you please, certainly in my case, in our Dean Suite, let us know and we'll address them. But can I actually just kind of take a moment to address one other thing that Gabriel mentioned? So notwithstanding all of the challenging, really challenging material hardships that have been addressed, whether it is, quite frankly, whether or not students have a safe place to go back to, the nature of their finances, all those sorts of things. I completely respect all those issues. And we as a university are doing our very best in order to address them. But let me, if I may, offer a bit of a slightly older person's perspective on some of the other things that he mentioned with regard to the disappointment about missing graduation, or the challenge of not having a normal freshman year, or being bummed about these sorts of things. History gives each generation their own sets of challenges. We often don't get to choose them. And I can promise you that your generation is not the first that has been set upon by what seem to be unprecedented challenges. Not just individual challenges that any one of us may have, but that come to define an entire generation because they are that broad. Whether it be your great-grandparents who may have hoped to got on to higher education or the other dreams in their lives, but had them impacted negatively and had to stay home due to the Great Depression because they couldn't find jobs, that had to help to make money for their own families. Or young people that were hoping to go off to college in the spring of 1941 or 1942, but instead found themselves marching off to war all across the planet. or your parents or great-grandparents who had to decide whether or not what their place was going to be in the great battles for integration and desegregation in this country, or where they stood on whether or not to fight in the wars in Vietnam, or um, your parents or grandparents who may have had to make some very hard decisions with regard to immigration, whether or not they're going to stay home, stay in their home birth countries, or come here. This is your generation's challenge. I know you didn't choose it, and I know that it's not fair. But I also know that you can draw strength from the resilience that has been demonstrated by your ancestors. And we need all of you to be able to do that now. This is a challenge the likes of which the world has not seen in at least a century. And we are all going to have to pull together to figure out how we make it through, because there is no going back to normal. The only way out of this is through. And so I would just respectfully encourage you, as I have, let us know the particular challenges that you're facing as it relates to questions of identity or racism, or questions of financing or health. But I also encourage you to reset your mental frame of what you consider to be normal and what your place is in the historical cosmos. Because this is going to be your generation's defining battle. And my prayer for all of you is that you acquit yourselves in ways that will not only help to strengthen our community, but that will also help you to be demonstrative of the resilience that you're going to need to show in order to get through this. Thank you.
And Gabriel, may I also, first of all, thank you so much for bringing that perspective. I think it's very important that we hear that voice. I want to also let you know that we too are disappointed. Sometimes it might not seem like we are as connected. There are definitely students who I remember coming in as first-year medical students, and I was definitely looking forward to watching them walk across the stage as well. And so I think we all share some disappointment. However, I often say when you do diversity work, one of the things that makes you successful in this work is that you keep hope alive. Sounds like an old saying, but really that there's always hope, there's always optimism, that even through this really unconscionable storm, that we will learn some things, that we will develop a sense of community, hopefully, that we haven't had in a long time, that we'll be able to, as I said, learn the stories of each other and really develop relationships that before we probably were a little bit too busy to cultivate. And then lastly, I know it's a little bit different, but having the opportunity to come back a year from now, having lived a year away from this experience and really being able to celebrate with your GW family is something that we hope that you guys will be able to take pleasure from.
Thank you, Dean Briggity and Grace, for your remarks. I think they're wonderful notes to wrap up, just to be mindful of everyone's time. I want to say thank you again to all of the incredible panelists for being with us. I am seeing a lot of information in the chat and in the questions that are just saying thank you for the space, and thank you for your voice. So I want to echo that and amplify it. Just so everyone knows, we, at least in diversity and inclusion at Elliott, we're trying to have more webinars in the future. So we'll look through your questions and the chat and see if there's some follow-up that we can do with our community, and again, in collaboration with our amazing partners across campus. So I did want to plug our next webinar. We're having a keynote presenter next Wednesday, Dr. Daryl Wing Su, who I actually studied all of his expansive work when I was an undergraduate researcher on racial microaggressions. So if you're interested in learning more about microaggressions, about bias and discrimination, and some of the topics that came up tonight, you can go to our website, which will be linked once you close out of the event, and check that out. And you can always contact me if you'd like to be connected with any of the folks that you heard from tonight. And you should have all gotten an email from me, so you have my contact information. So we're going to go ahead and wrap up, but thank you again, everybody. It was lovely to see you.